Afternoon, evening, everybody. I'm Mike Canning with Synovis MCA, and we're going to talk about one small part or a couple instruments today that are in your microplastics and micro ENT set, and those are the GEM instruments. And to refresh your memory, if you've seen them, it's these three comprise the GEM instruments. The GEM 2740 coupler device, the coupler forceps, of which there are two in each tray, and the measuring gauge. So they look pretty simple, pretty straightforward. We're going to spend most of our time talking about cleaning and care of this instrument, because it's really important that the right steps be followed. And to that end, this year we kind of belated, but we came out with basically a poster of the steps, so the in-service on the wall. Okay. So when I'm gone, as you're, if you wind up in there and you haven't seen this for a little while, this will be a good reminder on the things we talk about today. So, and I brought in two for Shamu. I suggest you put one up on the decontam side and then one on the on your clean side as well. So as we get started, I've got a couple of videos. We're going to kind of go old school here with the poster and with some show and tell. So I'm going to pass this little baggie around with these two plastic rings in it. Once you pass that around, take a look at it. Those are the GEM couplers that are used in surgery, and the purpose of these little rings is to connect very small blood vessels, and that's what they're using these instruments to do. So as you pass that little baggie around, the biggest one in that bag is 4 millimeters. That's the biggest they come, and they go down to 1 millimeter in size. So when we're talking micro and small, it's really, really small. So the blood vessels that they're working with are of that size and that diameter. So with that said, I'll tell you a little bit about the surgery and why they're using these coupling devices and how they're using these instruments, and we're going to put this up on the video. So why don't you start running that, Shamu? So what they're doing with these cases is they're doing in head and neck, and I'll tell you, just pause it right there for a second. In head and neck and plastic surgery, they're doing what's called free flap surgery. So free flap surgery is used typically when there is some kind of defect or deficit that a patient has from tissue having been removed. So maybe they've had some muscle and skin removed, to where there's kind of an unsightly or unshapely, as well as functionally, a deficit that needs to be restored. The good news is, the good Lord gave us all our own set of spare parts. And so what they're doing in surgery upstairs in these free flap cases, such as the deep breast reconstructions and the head and neck reconstructions, is they're taking a piece of tissue from somewhere in the body, sometimes the forearm, sometimes the thigh, sometimes the rear end, the belly, and they're taking a flap of tissue that includes sometimes skin, muscle, fat, and then the corresponding blood vessels, and they're moving it somewhere else to do the reconstruction. So oftentimes, unfortunately, these patients are either oncology patients, they've had a cancer and cancerous tissue removed, or they're trauma patients. So that is here at Level 1 Trauma Hospital. Sometimes that's the case. Probably most frequently it's oncology patients. So for instance, in the deep breast reconstruction, a patient is diagnosed with breast cancer, has a mastectomy to remove the cancerous or the tissue that's at risk from the breast, and it creates a change in the shape and the form. And so there's a couple ways that they can do breast reconstruction. They sometimes use implants for some patients to restore the shape of the tissue in the breast. But other patients they will do, and for some reason, some patients can't receive implants without other complications. So they will do a deep flap. And deep is, if you see it on the surgery schedule, it's DIEP. Deep inferior epigastric perforator free flap. And what that's referring to is the blood vessels that they are using to, when they create the flap, And they take that flap from the belly right here, and they take two triangular shaped pieces of skin, muscle, fatty tissue, fascia, and so forth, and they move it to the chest like this to do the reconstruction. So that's what they're doing. We're going to use this video here to kind of demonstrate that and explain it a little better. So if you see in this picture, it's obviously a graphic animation, but if you can imagine, so this is the chest of a patient, and there's a blood vessel here, which is where they're going to attach the flap to. And then this up here is representing the flap. You can see skin, fat, muscle, and then what's called the pedicle, and that is the length of tissue that has the blood vessels in it. Because any tissue to be viable, to grow, and to be healthy, and to heal, has to have a blood supply from an artery, and then a blood outflow from the vein. So that's what they're working with. And that's where these devices and instruments come into play, particularly with the vein, because the vein on the outflow portion of the flap is between 1 and 4 millimeters typically, and in the breast cases, usually it's about 2 or 2.5 millimeters, sometimes 3. But the quality or the nature of the tissue in the vein, it's very flimsy, if you will. It's kind of rubbery. It's sort of like a stretchy cobweb. That's kind of what the vein looks like. The alternative to using this device and these instruments is to suture or hand sew that little tiny vessel together through this very wispy tissue. So about 20 or 30 years ago, this gem coupler system was developed. So it's not new, but the steps I'll cover with the care, cleaning, maintenance, and whatnot, I'm probably a little overdue of getting in here to share that information with you. But in the meantime, anyhow, so Shema, why don't you run it for a moment. So bring the flap up. And the first step they do is they use the measuring gauge to determine what size of disposable gem coupler that they're going to use. The gem couplers look like this. Let's pass one of these around. Pass one going in the other direction. That was a 3.0. This is a 2.5. And that's what they're using to connect the veins. It's sort of like, if you think in very simplistic terms, it's plumbing. They're connecting the ends of two pipes together, and it's sort of like a flange and pipe system to create a connection. So, Shema, if you roll that. Okay, so there's 7 different sizes, as I said. They're color-coded. That portion of it is the disposable part, the disposable product part that's upstairs in the OR. And this is the GEM 2740, which delivers the coupler. So, yeah, go ahead and roll that. Okay, so what the video is explaining here, you saw me load it real quick. You slide it on, thank you. So this is what's done during surgery in the OR after they've determined the right size. So just stop it right there, Shemu. So when the surgeon has measured the veins and said, okay, give me a 3.0 coupler, that's the yellow one that you see there. What I want to point out here is, as I pass those couplers around, the ones in the bags as well as the one in the anastomotic device, you see these little pins? The way that these rings connect together is there are tiny, sharp little pins. There's 6 in each of the rings, and up to the 3.0 size, the 3.5 and 4.0 have 8 pins. But the pins are very sharp, and on the opposite side, you see these holes. They're aligned so that when this device comes together, the tip of the pin fits into that little hole, and it squeezes together like this. So I'm going to pass this one around like that. Take a look at those pins very closely as we run the video here. So the surgeons will take the vessel, the vein that is, pull it through the center of the ring, and then they will peel it back or evert it or double it back onto the plastic ring by sticking it onto the pins. Now, that's where this second instrument comes into play. This is the coupler Forceps. You see how they push it down right there? I want you to take a look as I pass these around. The coupler forceps, which is also known as the hockey stick, if you squeeze it together and look at it like that, I can barely see it with my eyes. Hopefully your younger eyes, you might be able to see it, but there's a little hole in the top of the instrument. Pass this one this way. Take a look at that. And that hole is really important because that's what they're using to push the vein tissue down onto the coupler ring. So we'll get to that a little bit as we go along. So any questions on that, on what they're doing and how they're connecting the vessels? Okay, so let's jump ahead to they've done a surgery upstairs. The plastic micro tray comes back down with the gem instruments in it. And you're often going to see those trays on this shift because one of the interesting things about these cases is that they're very long. So they're basically doing two surgeries in one. They're doing a surgery where they're taking out a cancer, and then they're doing a surgery to bring the flap up and put it in place. So it's sort of like a 2-for-1. They're very lengthy surgeries. So 7:30 starts on these surgeries. They're often going into the late afternoon and sometimes into the evening. So as a result, when the trays are finishing, or when they're finishing with the trays, they're coming down, and you'll see them on your shift. So first things first, and then we're going to show a video of an actual surgery, is if the coupler device, so up on the wall poster here, there's a picture of it up here, and it's showing removing the plastic wings, or the disposable part of the instrument that deploys the coupler. You shouldn't see it this way, but stuff happens sometimes, and sometimes it comes down like this. So after the coupler has been put in place or deployed and it's connected to vessels, the nurses and the techs upstairs should squeeze the button, pull this out, and that goes in the trash. They will typically use at least 2 of these in a case, so they have to replace it at least once. Sometimes they'll use more. Sometimes 3 or 4 is possible. So they will reuse this device in the same case, but what happens is sometimes after that last coupler is placed, the instrument comes back to the scrub nurse or the scrub tech, and they put it down with their other stuff, and it gets covered up by something, and as a result, sometimes it comes down here with the disposable in it. Shouldn't, but if it does, and you're on the decontam side, and you see this, first thing you want to do is just check to make sure that it is open all the way. So that means you're turning the thumb wheel counterclockwise. If you see on the wheel here, it says close with the arrow pointing clockwise. That's indicating the wings on the end here, the open close. So it's a little counterintuitive, but you basically want to turn it counterclockwise as you're staring at, looking at it until it gets to the stop. You can see the wings are all the way open. Push the button, pull this out, throw that in the trash, and then please let one of the supervisors know that one came down with a with a disposable in it, so they can notify probably Molly upstairs in plastics. I think it doesn't happen often, but it can happen, and usually it's just that the nature of there might have been a late shift change or something, and it just got overlooked. Anyhow, so in most cases, your instruments are going to come down without the disposable. So when it does, this instrument in particular, as I explained with that last video, and you'll actually see in a real surgery here in a minute, it's very, as you can imagine, it's very fine work. So when the surgeons are placing the coupler device, they're doing that portion of it underneath a microscope. So you have the surgeon and then the assisting surgeon directly across the table, and they're looking through the microscope down at the surgical site down here like this, and they're operating like this. And it's like little tiny motions, and I'm like, whew. I drink too much coffee. I couldn't do it myself. You gotta have steady hands to do it. But the point is, it's very, very fine work. Very tiny motions are very noticeable. So it's important that this device in particular really work very smoothly. And I have one here that I keep on my demo and in-servicing set that is very rough. Can you hear that? And it's very chattery. Should give that a whirl. Whereas the other two are very smooth. That's what you want to hear. So with that instrument, and if you come across one that's like that on your set, I don't think any are. We may need to send it out to get it opened up and take a look at for repair or what have you. But that's what comes to the cleaning and the care of this. So there's a couple internal parts to this instrument. There's a big screw in here, and then on this end there is a lever and a spring that operates to place the coupler on, as well as then remove it, as we just talked about. And those internal parts need to be flushed and cleaned every time this instrument comes through. So here's how you can do that. Number one, there's a port in the back that you can very easily apply under some pressure. Flush it through until it drains through the front with clear, with water or with clear fluid. You flushed everything out, and then in the front, the hole where the post for the coupling device, the disposable part where that fits in, you flush it through that hole as well under pressure or with the spray nozzle. And while you're doing that, check to make sure that this is all the way back open. But flush it and then operate the spring a couple times, because fluid, tissue, blood, and whatnot can collect in the spring, which can make it sticky. So just move that up and down a few times to avoid that. So you want to flush both ends until you have some clear water, clear fluid coming out. Externally on this device, we suggest soft brushes versus stiff metallic brushes. There is a coating on the outside of the instrument that a metallic brush over time will scrape it off, so we don't want that to happen. But then basically just visually giving that thorough cleaning of fluid, tissue, and what have you on the outside. You can then place this instrument through your ultrasonic machines, your washing machines, the standards and all that. It's pretty standard for any type of instrument. There's nothing unusual with those. And I just gave you a copy of the IFU with all those particulars to Shamu, but I'm sure you're already running these through your washers and probably your ultrasonics. So that's fine, keep doing that. And then once the instrument comes through on the clean side, after being washed or flushed and washed and cleaned externally, the next most important step that is described in the poster is right here, and that is applying a water soluble milk lubricant internally to this instrument. So it's just like, in your car, the pistons in your car, you got the oil coming into the cylinder so that the piston can slide up and down, right? Same thing with this instrument. You want to take your milk lubricant and apply it through the same ports where you flushed it. So through the hole here, through the hole in the front, again with this open all the way, apply some milk and then work it in by operating the spring up and down like so. And then you can apply it externally along the rails and so forth. Basically, be generous with the milk with this instrument. You want as much as possible internally. And then once you've done that, then operate it back and forth a few times and just make sure it feels smooth like this one and not like the one I passed around that's all squeaky. So with that done, this instrument then is ready for sterilization in the set. Any questions on this one? Yes?
So I know like with some of our trays, like if one of the major pieces needs to go to repair, the whole tray have to go. So
Okay.
would the whole tray have to go with that piece too if it need to be repaired?
Yes, because you can't really do the surgery without this instrument in it. Now, you've got, I think, 10 trays, 10 plastic micro trays. So you don't have just one. But that's because of the volume. You're using these trays and this instrument very routinely. Some weeks they'll do upstairs between E&T and plastics. They'll do 4 or 5 flaps in a week. That can happen for sure. Other weeks, it might be 2 or whatnot, but you're using these very steadily. So if one of these goes down, it's not going to knock out all your trays, but certainly that one tray, maybe we could look at having one extra in-house or something in the event that happens. But at the moment, that's the case. I don't think you have enough trays, and I don't think it really would be an issue. Repair to, if it goes out, if we send it out, I'm sorry, I'll get you in just a sec. It does take a few weeks to get these back, but I do ask, please bring this to your supervisor's attention if you have any concerns about this one, if it's feeling a little rough, if it's sticking at all, if the button is sticking down on the end, please let someone know, because it's not going to load the coupler correctly if that's the case. And anyhow, if this comes to my attention, we can send it off. It goes off to the company that builds these for us. They take it completely apart, and we'll replace any of the internal parts that are needed. If it can't be repaired, it doesn't cost anything, and then you can get a credit towards buying a new one, which I would work out with Shamu or Brandon or Victor upstairs or what have you. So there's a couple options, but it does take a few weeks. So I'm sorry, question?
Yes. How many of them usually come in one set?
So there's one of these in each microplastic tray.
Okay.
Yep. So that's why if there is an issue and it does go down, it's probably going to knock out that tray unless you have another backup, which I brought in loaners in the past, so we could work it out. Okay, any further questions on this one? And let me just cover a couple points on this, on the coupler forceps. So this is pretty simple and straightforward in terms of cleaning steps, because it's just like all your other micro instruments that are in the tray. Number one, and most obvious, it's very delicate, as all your micros are. So I know you take a lot of care in handling and cleaning them. One thing I would suggest that I'd ask that you do every time with this instrument, it's the GEM 4183C is the official name, the coupler forceps, but you'll recognize it by the slang of the hockey stick. And the reason I'm waffling at this one a little bit, so this is one I got from another hospital that had been dropped, and I saved it for in-servicing. So take a look at that one. That one is pretty obviously beat up. If you see one like that, please let someone know, because that one cannot go back into the tray. What you need to inspect with this instrument every time under the magnifying glass before it goes through final sterilization is close it, line it up, and check the hole and make sure that it is making an even hole like this. Because as you saw in that animation, and we'll see for real when I'm running this video, if it's misaligned like this, that very thin, flimsy tissue, instead of pushing it down, it can actually tear it. So as it pushes it over the pin. So that we don't want to happen. So if you see any concerns with this particular instrument, the hockey stick, please bring it to the attention of your supervisors. And the main thing is just checking to see that it lines up and that the blades come together evenly. So any questions on that one? Oh, and the final thing, which I forgot to mention this morning, which I'm sure, in fact, I know you're already doing, but please keep doing, definitely on the coupler forceps, tip protectors on every one, every time. Okay, so questions on that stuff? Did I miss anything from this morning? No. Okay, let's run this. This is a video of a surgery that was taken through a microscope. So this is a real surgery, real patient. And you'll see how they use these instruments. You'll notice the other micro instruments, dilators, jeweler forceps, and so forth, as well as the clamps, the Acklin clamps, because before they're operating on these vessels and before they cut them, they have to put a clamp on them so that they won't bleed, right? So they clamp both sides. And this is the vein. You see how this one is actually fairly thick and robust, but you can see it's sort of stretchy, and it is a pretty thin wall, something that would be easily torn or damaged, and it's wispy enough, it's very difficult to hand sew or suture through. which they're using very tiny stitches and needles to do that. Anyhow, so they measure with the measuring gauge. The surgeon will say, okay, give me a 2.5 millimeter coupler. They pass that on to the field, and then, as we showed you earlier in the other video shows, they load it on.
Keep spraying it to find it.
Yeah, so what they're doing, squirting, is they're using saline mixed with heparin. And the reason they use that, heparin is a vasodilator. It relaxes the blood vessel so that it makes it very flimsy and stretchy. It's kind of like when you go to the eye doctor and the eye doctor puts those drops in your eye to dilate your pupils and make them bigger. That's what they're doing with the with that irrigation, as well as just there'll be a little bit of oozy bleeding sometimes, so they just flush that out so that they can see what they're doing. Okay, so they line the vessels up, and I think they're going to come in with the coupler here in a moment. They put that background material in there just to provide some contrast. So, and then they'll come in with the coupler.
You want me to skip forward?
Yeah, why don't you just skip forward like a few seconds, just until you see the coupler. Okay, that's perfect right there. Okay, so they come in with the coupler and the device. Oh no. And they're one by one putting the vein, the walls of the vein, onto the pins. So they're holding it like this. And there they go. And here they're using like a jeweler's forceps to do that. The coupler forceps is intended for that. But sometimes they'll just grab, another instrument and work with that. And you'll see them use the coupler forceps here in a moment. But they kind of make a triangle first. And see how the vein, the tissue, it's sort of like rubbery and really stretchy. But even though you think it's sort of like a rubber band where you're going to pull it like this, it can tear pretty easily. So they do have to handle it gently and be very careful on how they're applying it to the pins of the coupler. Alright, so they'll get it all the way on. They want to get full thickness, so they want to get both the inside and the outside wall of the vessel, and it kind of, once it's on there, it kind of forms, looks like a tulip. Then they'll squirt it, and there you go. And then when they load it on the other side, so when it comes together, it puts the inside layer, or the intima of the blood vessel, is touching each other. So ultimately, a blood vessel will grow together on its own. But this coupler is permanent in the body once it's implanted. The plastic ring and the stainless steel pins they're very inert, so the body doesn't really react to them, like it doesn't cause an infection or anything like that. And the reason being is to make this connection with the flap back to the body. To remove that piece, they would have to do a whole other surgery. It just doesn't make sense to do so. So there are lots of people walking around with gem couplers in their body, in their chest, or in their head, or elsewhere, sometimes in the legs or hands. Reconstructions are done with flaps. And one of them is my sister. She had one of these surgeries last year with a gem coupler in New York. So, all right, so they get it loaded up on both sides. And then you'll see that, okay, they squirt again. And then, so they're doing this. You can't see it off the screen, of course, but they're going to start turning the knob to close the coupler. There we go. And then you see how the pins kind of line up? It's like a Venus flytrap coming together. Then they'll come in and they'll use a hemostat, just a standard hemostat off the set to kind of squeeze it closed. It's a press fit. There's not enough spring pressure within this device to close it completely, so they'll help it along with the hemostat. Then they'll take the clamps off, and you see the blood flow start to go through, which is what you want to see. And you don't want to see any leaks. So just like in your plumbing at home,
Right.
You put together the PVC, you put that purple glue stuff on there, you don't want the leak after that. Fortunately, these are very reliable instruments, and they rarely is there a leak. If ever it is, it's just because sometimes they need to squeeze it together a little further. But that's what it looks like. So, so they've connected the flap to the vein, and then they will typically hand sew the artery. So like your needle holders and your grasping forceps, like your platform forceps, jewelers. Those are the ones they're using when they're suturing. The artery is a thicker vessel. It's much on a relative basis bigger vessel by a couple millimeters. So typically they will suture the artery and then couple the vein, and do that more than once depending on the surgery. But the reason they use this is just because of the quality and the nature of the venous tissue. It helps to kind of standardize from case to case as well as patient to patient. And some patients, honestly, their veins are so small and the tissue is so thin, it's really hard to work with. So the coupling device really gives them an advantage of the surgeons and then, of course, the patients, of getting the blood vessel connected safely and securely, and also very quickly. So the surgeons with experience using this system, we just watched this video, that was in real time. They can get the blood vessel connected within a couple, 3-4 minutes. So maybe 5 minutes versus when they're sewing or hand suturing, that takes about 25-30 minutes of really concentrated focus work. So, so I kind of ran through to the end. So any questions on that based on what you see up here? Obviously very, very fine work, very small work, and you can see in this video representation how like any extra motion or anything would really be detrimental. And that's why the details on these instruments are really, really important, and lubricating this instrument so it's nice and smooth every time it comes through is really really critical to its function. So with that, I think I covered everything. I forgot anything? Good. Any questions on that? Not to beat a dead horse.
I just want to say, on behalf of everyone, thank you for a fantastic in-service.
All right. Wow. I'll take a fantastic any day. Thank you.